So my topic today is initial experiences with Istent and Istent Inject in Indian eyes. This is a pilot study which is based on stratified outcomes and safety. So just to give a background, Istent is a minimally invasive glaucoma surgery device. We had the generation 1 Istent, which was one L-shaped stent to be placed in one eye of a patient. Then came the generation 2, where there were two dumbbell-shaped Istents to be placed in one eye of a patient. So the principle basically, by and large, is about trabecular meshwork bypass, wherein if you place the stents at the level of the trabecular meshwork, which is obstructed in POAG, you tend to create a passage out for the aqueous from the anterior chamber into the Schlemm's canal. So the aim of our study was to see if Istent Inject was effective in reducing intraocular pressure, if it was effective in reducing the number of anti-glaucoma medications, was it safe, and how did it compare to the G1 stents. This was a retrospective case studies. We took 15 eyes of G2 stents and 11 of G1 and followed them through 6 months. Primary outcome measure was the percentage IOP drop and percentage AGM reduction. Complete success was defined as IOP less than 21 with no medications, qualified less than 21 with AGMs, and failure if the IOP could not be controlled and was beyond 21 with AGMs or need for additional filtration surgery. We used the pair sample t-test to compare IOP and the number of glaucoma medications pre and post operatively, and statistical significance value was taken as p less than 0.5. The baseline IOP in the G1 group was 20.55 and the baseline AGM was 1.82. In G2 it was 22.06 and the AGM baseline was 3.06. They were both not statistically significant when it compared the two groups. The effect on IOP with G1 at the end of 6 months was only about 0.5% drop in IOP. With G2 stents, there was a 32% drop in IOP seen at the end of 6 months. When it came to the effect on AGM, there was an 80% drop in the need of anti-glaucoma medications at the end of 6 months with G1 stents and about 70% with G2 stents. Complete success was 64%, which means that with the G1 stents, when all the patients were on some or the other AGMs, at the end of 6 months, 64% were free of anti-glaucoma medications, and in the G2 group, 57% were free of anti-glaucoma medications. We also stratified them with the stage of disease and saw that there was only statistically significant reduction in anti-glaucoma medications in the mild to moderate and in the severe group with both G1 and G2, while there was none in reduction of IOP. Also, when compared with phaco and without phaco, when G2 stents were used with phaco, there was a significant drop in IOP. And when the G2 stents were used with or without phaco, there was still a significant drop in anti-glaucoma medications. The safety profile was high. We saw in about 20% post-operative hyphema. There were also IOP spikes in about 17% of our cases, and 1 each of steroid response, iridocyclitis, pigment dispersion, iris chaffing. Visual acuity was better than preoperatively in 93.33% of patients, and visual fields remained stable. So we conclude that Istent Inject is more effective in reducing both IOP and AGMs at the end of 6 months when compared to G1 stents. Both had good safety profile. G1 significantly reduced only the anti-glaucoma medication load in mild to moderate group, whereas the G2 in all stages of glaucoma was successful in reducing the anti-glaucoma medication load. Higher baseline IOP was associated with larger reductions in IOP. So in conclusion, I think G2 Istent devices are suitable for use in patients in whom medicated IOP is controlled preoperatively and only a reduction in anti-glaucoma medication is desired. Why this study matters is because there is absolutely no literature available yet of the outcomes of Istent in Indian eyes. The study limitations, however, are this is a non-randomized study with no control group. It is a heterogeneous cohort. However, this does represent a real-world clinician's glaucoma population and insights into early safety and efficacy of Istent Inject eyes in Indian eyes. Thank you.
Thank you. A nice study. I would just like to ask one question that what are the methods, the investigative procedures that you do pre-operatively to ensure
Dr.
that
Shubhangi on
the
the
success
podium.
is more in such cases, because there is like the chances of failure are quite high in these cases in the use of Istent.
Right. So none really, sir. There are no investigations which can ensure that your MIGS procedure will be successful. However, we do have an indication criteria, which is usually a cutoff of 30 millimeters of mercury IOP, not higher than that, which is a medicated IOP. Or if you are, if the patient is suffering from AGM allergies, intolerance, or for any particular cause, you want to take the AGMs off the patients, particularly preferred with phaco. So if you have a glaucoma patient coming to you for a cataract surgery, you give them the option of combining them with mix so that the AGM load can come down.
Actually, it is the drugs that are acting on the trabecular meshwork. If they are working, then the eye stents are likely to work more.
Correct.